and understand what kind of efforts has Project Step One been doing, especially in the second wave, and how different is it from on-ground efforts when you look at it from the first wave?
The second wave definitely is very different, and I'll try to summarize the differences, and that has also affected our efforts. So the big difference in the second wave is, as Dr. Yash said, it is affecting families. It's affecting. There is a sense, or there is an understanding that the virus itself is more virulent. So there is that much more precaution and care that needs to be taken. Also, it is affecting the comorbidities, which were a new comorbidity. Of course, in the first wave, all of us know that people with diabetes and hypertension and any other chronic lifestyle disease was severely affected. But this time, obesity has come up as a huge comorbidity, irrespective of the age. So being so it's something that people have to be very, very cognizant of, especially if their BMI is beyond a particular value. They need to be extremely careful about getting about the precautions. The other thing which we are seeing this in the second wave is that a large number of people their saturation levels are going down, oxygen saturation levels are going down. So early treatment, in fact, this is actually as breaking news as you can get. On 3rd of May, AIMS actually formally released their official treatment protocol, which is new, which helps people's saturation levels from going down by taking a certain prescription of medication. If so, in the first wave, the only medication that was prescribed for a vast number of people was paracetamol and vitamins. However, the prescription, there are certain, so mostly they were OTC or over-the-counter drugs, which anyone could get access to. But in this wave, to stay at home and stay safe and not having to require a hospital bed, there are certain prescription medicines that are required. So consulting the doctor is become very, very important. Early consultation with doctor has become very important. So due to all these things, and also the biggest issue with the second wave is the numbers are way more than the first wave, which means that every resource that we had is not available anymore because of the sheer numbers, right? Hospital beds are not available. Oxygen beds are very scarce. I think all of us know about the oxygen scarcity. The ICU and some medicines are also scarce. So the prevention is the real hope for us. And the second thing that we need to do is get as many people at home as possible. So from that standpoint, Project Step One role has become more important in the second wave, because we have to, as soon as someone tests positive, we are actually calling them and ensuring that they are proactively assessing themselves for their comorbidities and taking this medication, getting our doctors to prescribe these medication to the citizens. So our role when in these times, in trying to keep people at home and just keep them away from having to go to a hospital, and reducing the burden on the hospital system has actually increased tremendously. So that's I would say the new role of Project Step One in the second wave.
Right. Doctor, we were talking just adding a segue to what Rags was saying about the healthcare infrastructure. It is no secret that, the pressures have been very severe on the healthcare infrastructure, whether it is getting beds, medicines, oxygen, it's no secret. So I just want to understand what steps we individuals can take to ensure that there is a lesser spread of the virus so that our infrastructure doesn't get impacted. Just adding to more points from what Rags was telling.
Yeah, continuing from what Rags was telling, we need to say that more than 90 to 95% of people are getting treated well at home. They are getting cured at home itself. They do not go to the hospital. So just they need a good consultation, which Project StepOne is doing. Many of the doctors have joined Project StepOne and are giving teleconsultation to these patients. We just need to monitor few things like oxygen saturation of the patient, the fever of the patient, minimum 3 to 4 times a day. If possible, we can make a chart of it. The oxygen saturation, only and only if they drop below 93, we need to start arranging a bed in a hospital. Need not arrange a bed before that. And even in such case where the oxygen saturation is going below 93, first consult the doctor which you have been consulting since the past 14 days. You need to consult him in case if the oxygen is needed, and if it can be given at home, we can give that oxygen even at home as of now. We need not rush to the hospitals. Do not go out, taking the patient roaming around all the hospitals, no beds available. Do not go until and unless your doctor advises it. Once you are in touch with your doctor, he himself will guide you towards the admission process and everything mostly.
Just want to understand about, from the both of you, families as such are getting hit. Now, when such whole families are getting infected, what should they keep in mind? What should they be in mind? Because there are children. Last wave, there were children were not getting impacted. Now children are being tested positive. So with children, there's parents, there's grandparents, and then maybe some relatives. It depends on the kind of family structure you're living in. And in India, there are a lot of joint families. So how do you work around that? How does that also is putting a lot of impact on the healthcare infrastructure? So if families test positive, what can be done in such cases?
Yeah, the first and foremost thing is we are missing out the case zero symptoms from the case zero of that family. If we identify these symptoms from the case zero, that is the first person who is getting infected and getting the symptoms, we can just isolate him. And once he is isolated, the rest of the family will be saved. 90 to 95%, the rest of the family won't be getting infected if he is isolated on time. Well, coming to the whole family is getting infected, we all should act like a family as we are, and we all should boost each other's morale during family containment or being infected. Each of the family member has to boost each other's morale. Do not let the morale go down. That is the only thing which we need to focus on. I think Rags may continue from here.
Yeah, Rags, also if you
Yeah,
could
so
add just sorry to interrupt, but if you could just also add, like when Dr. Yash rightly put the impact on the mental health, there's a lot of anxiety, stress involved with it. So how do you work around that? If you could just add even on that.
yeah, so the continuing with what Dr. Yash was saying, I think if if we do early isolation, then I think there is a good chance that you can still prevent, even in this way, other family members from getting infected. However, one of the things that everyone should realize is that waiting for a confirmation of a test, or waiting for a positive test result should not be the criteria for isolation. As soon as you see the symptoms, you should start isolating. In fact, for people who are having any risk, like elderly, people with comorbidities, even treatment should actually start as soon as people are experiencing symptoms. So early treatment is the key. And also, like what you clearly mentioned, there is certainly a lot of fear and anxiety. And for the most part, most people will be fine if the early treatment is available and early intervention is available. So having a positive outlook and keeping a positive sense is very, very important. And if you feel that you are not able to be positive, if you have a lot of fear which is unfounded and not common, if you are having symptoms or if you're feeling over anxious about something, then you should reach out for help. There are several helplines. Project StepOne is also running mental health helplines. You should try to speak to someone who can give you help, as well as you should try to speak to each other and share openly your fears with other person, because they go a long way in you to feel better so those are very important. In the Indian context, the mental health itself is still a taboo. Reaching out to a counselor is not something that is looked upon. It's looked upon as a sign of weakness, which is very, very wrong. I think all of us should reach out to the right mental. All of us have to. It's a very natural phenomenon. It's our body which is reacting, and it's our mind which is reacting to the trauma. So I think all of us should encourage people who are having these symptoms to reach out for help, as opposed to trying to put them down or thinking that they're not tough or anything like that. Because even for the toughest of people, mental health counseling can have mental health problems.
Right.
Well, just to add a few more things,
Yeah.
once the whole family is involved in this, the whole family, they can form a family activity kind of thing. They all can sit together with adequate distance, definitely. They all can perform yoga, some pranayam, some asanas, and just make fun of each other and just boost up their morale. That is the only thing. Well, if they are not able to do this, helplines are there to help them, definitely.
Yeah. Before I step further, if there are any questions, just put it out in the Q&A segment, and we'll definitely ask the panelists here. Doctor, just want to understand now that the vaccination drive is starting full force, and we are hoping that everyone gets vaccinated, and everyone should get vaccinated. There are still a lot of misconceptions, still a lot of myths associated with it. It would be great if both of you can clear some of those. How does it work? How does the vaccine work? How does it actually help? Because the biggest question is, a lot of people who have even taken the vaccine have been tested positive. So there's a lot of questions around it.
Maybe, yeah. So first thing is, we would like to encourage everyone to take a vaccine. Now that it's available or it's allowed for every age group, everyone should take a vaccine. A vaccine essentially is something which reduces the complications if you ever get infected. So the best way to think about the vaccine is like a seat belt, right? If you are wearing a seat belt, you can't prevent yourself from having an accident. But when you have an accident, the chances are that the effect of that accident in terms of injury as well as death is minimal. So the vaccine is basically like a seat belt. So think of it that way. There is a good chance, even after you are having vaccination, you should continue to wear the mask. You should continue to all the safe protocols. But if you are infected, then the chances are that you will come out of it very, very fast. In fact, studies have shown that less than very small percentage, 0.03% or someone have been affected in post-vaccination. And another misconception, I think, is one vaccine versus the other. I think that is also completely misfounded. Please get vaccinated with the first vaccine that you can get access to, because both vaccines are equally good. The studies basically of efficacy are not carried on a large number of people yet, but and the studies are very early. And the difference is probably 2%, 83% versus 85%. Those 2% doesn't actually make a difference compared to you delaying the vaccine for the right vaccine to be available. So these are, I would say, the two most important things that I would like people to take along. Over to Dr. Yash.
Yeah, thank you. Coming to how does a vaccine work? Well, to explain this, we need to understand how a vaccine is made, first of all. Vaccine is made, just to give you a simple example, or just to explain it in the simplest way as I can. Vaccine is made by some dead viruses. Suppose if I am a virus, all the internal organs from me will be removed, and only my skeleton part will be introduced inside your body. So once I get into your body, I'm not good enough to cause any damage to you. On the other hand, the body cells will recognize me as a foreign body, and they will attack me, finish me off. So later on, when the actual virus attacks you, the body already recognizes that virus and it attacks that virus even before it starts multiplying into one's body. So this is how vaccines work. Coming to myths and misconceptions, yeah, a lot of myths and misconceptions were there. Well, it is all based on their physical, organic, and intellectual responses, like what all they believe. Many people were believing that these people are just testing the vaccines on us. All these beliefs were just vague and had no base. Whereas all those people are now coming forward and are eagerly waiting for their turn. So getting vaccinated is the only way out of this pandemic. I would say as soon as you get your chance, as soon as you are appointed, you need to get yourself vaccinated. No second questions on it.
Sindhu, you're on mute.
I'm unmuted. You brought in a very, very, very important point, Rags, on the fact that home make use of the home healthcare systems and the digital systems. Can you tell me how that is helping in times like this? Does it help in early detection? What is working? Because nowadays, even a common cold, many people are getting scared of it. But by talking to a doctor, you might actually be able to understand if it's a common cold or are you actually showing the symptoms. So can you just give a little brief idea on how home healthcare systems can actually help and why people should use it extensively?
Yeah, so we are dealing with a pandemic which is extremely virulent. So you need to first understand that you both have uh, to be careful yourself, and you have a responsibility to make sure that if you have any risk, that you isolate yourself and prevent it from anyone else getting it. So first thing is, if getting it from any other member of your family getting it, so as soon as you see any symptom, isolate yourself within your own home and reach out to a doctor. And there are many health online health platforms. Project StepOne, you can reach out for free. We have thousands of volunteer doctors and other trained paramedical and non-medical volunteers who are trained on guiding you, whether based on your symptoms and based on your contact history, whether you have any risk of having contracted the virus. So they will guide you when to take a test. So don't assume that it's a common cold. Any of the symptoms, you should immediately try to ascertain from a trained professional whether you should get tested or not. You should actually believe that there's a good chance that you are. Also, there are a lot of different symptoms that have come up in this wave due to the new variants. I think skin rashes is a new phenomenon that we are seeing. We are seeing diarrhea and several gastrointestinal problems associated with this virus. There is also pink eye conjunctivitis, which is a new symptom that has come up. So the chances are that if you have conjunctivitis, it is a pink eye, and if your eye is in pink in color as opposed to red in normal conjunctivitis, then there's a good chance that you are actually having the variant of COVID-19. So there are several of these symptoms that you can actually recognize for yourself, make yourself acquainted, and or don't take a chance. Please reach out to one of the helplines. Reach out to Project StepOne helpline because it's free and it's always available for people.
You
Yeah,
know,
just to add where Rags ended, we need not ignore any of the symptoms if we see. Do not take it as a common cold. As of today's numbers, 3.5 to 4 lakhs, any symptom which we see is a COVID symptom until and unless it is proven otherwise. You have to treat it as a COVID positive patient. You have to isolate that patient. No other chance otherwise.
right, right. I just want to understand again, like, from you, what is the biggest challenge you've come across? I mean, doctor, you on the forefront and on the front line, what are the biggest challenges when it comes to patients? Because I remember reading somewhere, I don't know if this is true or not, like, 3,000 people in Bangalore who were tested positive have suddenly their phones are switched off and they're not reachable. So all of this can cause a lot of more panic, more mayhem. They could possibly, be transmitting the virus. So I want to understand the on-ground challenges both of you have faced, and how can we help to make it easier?
Yeah.
Go for it, doctor.
Okay. So the numbers, first of all, in the last wave, we had the highest number which we had was 1.5 lakhs. But in this wave, the numbers are enormous. It is 3.5 to 4 lakhs we are reaching out. Definitely, there is going to be panic. We all need to consult a doctor as soon as possible is the only thing which I would like to say. That is the only thing which we are facing. We are not able to attend calls. There are so many calls which are coming up. And I'm not able to get you. You were telling something about phones were switched off. What was that?
Yeah, no, I'm just saying that I don't know how true the news is, but people who were tested positive were not being reachable. Like, BBMP had put out a message that their phones are switched off and they're not traceable. So that causes another set of panic and, fear among people.
Yeah, there is a lot of social stigma that is going around. A lot of people, once they are tested positive, have been isolated as if it is some kind of touch kind of disease that they are going through. We need to overcome this social stigma first of all. We all need to come in this together. Don't isolate that person or that family who is being tested positive. Just help them as much as possible is the thing what we need to fight this out.
Right.
Yeah, so some of the challenges that we see is, I think, people overly panicking, right? There is a situation where resources are low, right? So you should ideally, uh, you know, uh, you should let the resources be available for the most vulnerable, right? If you're feeling, if your doctor is telling you that you can actually get better at home, please don't choose or force yourself to go to a hospital, because a hospital bed can save somebody else's life. There is also an environment where people are holding oxygen concentrators at home, oxygen cylinders at home. All of these are very critical equipment which can save lives, right? If they are just lying in your home or in your office and not being used by someone, then you should feel that it is actually not being used to save a life for that day, right? Because we see a lot of people who don't have access to these on a daily basis dying, right? So I think it's a responsibility on all the privileged people to also try to help others and not hoard in any form. It is obviously human survival instinct versus social good, but I think we are hopefully well into the social uh, fabric of revolution or evolution, that we can care not only about just ourselves but also about the people around us. I think this pandemic itself is a good test of that.
Right. Dr. Yash, just want to understand, if someone has been tested positive, how can they themselves work towards using their health back?
Your audio was not
Okay.
audible.
Can you hear me better now?
Yes, yes, much
Yeah.
better.
So, doctor, I just wanted to understand that, if someone has been tested positive, how can they work themselves to ensure that they can nurse themselves back to health?
Well, the family members have to keep his morale high. He himself don't doesn't have to get his morale down. All the other family members have to tell him that you are good and you are going to get better day by day. All he needs is mental support from his family. If he doesn't have a family, we at step one are there to help them. Don't worry about anything. Whoever is testing positive, it is nothing. You are going to get out of it. Don't worry about it.
Right, right.
Yeah, I think one of the key things that I would like to add is all patients who recovered from COVID can have the chance to donate their plasma and save two lives. Plasma donation, when every recovered patient can donate their antibodies in the form of blood plasma to someone whose antibodies are not getting triggered, or whose body is unable to fight the virus, and uh, this could actually well save the other person's life. Each donation can lead to 2 units, and each unit can save one life. So, everyone who has got COVID and has come out of it successfully, every warrior can actually go and donate and save 2 lives. So that's a big thing. Which and they can only do it within 3 months of the date of getting COVID. So how many times in our lives do we get a chance to save lives directly by doing something? So every COVID recovered patient should take this opportunity and go donate plasma and save lives.
Right.
Yeah, I had made a similar video on plasma donation, which was endorsed by StepOne also. I myself have donated my plasma 3 times after recovery. Each time when I donated, my antibodies were around 3 times more than what was required. So definitely one donation can save 2 lives. And as you said, Raj, you won't get another chance to save these lives, these important lives. The patients who we donate the plasma, they are just falling short of words how to thank us. Just don't miss this opportunity to donate your plasma, is my suggestion.
Okay. My last question to you is to understand what is it that one can do if they want to volunteer for help or volunteer for Project Step One. How can they be a part of it?
So first and foremost, the backbone of Project StepOne are doctors. So if you're a doctor, please come forward. Uh, you can volunteer for Project StepOne, and in any free time, any time of the day, and any time that you are free, even for an hour or 30 minutes, and talk to patients. And you will be provided a training. Doctors of any specialization, any degree can actually come forward and help. Then we also are having a lot of nurses, medical students who can come forward and help. But in addition, we also have common citizens who can help in there is a special training we have developed for anyone who has good communication skills to come forward, because there are obviously the number of doctors, the number of cases are so high that every case cannot be talked to by a doctor. So all the people who are having mild symptoms or asymptomatic, they can still be counseled by non-medical professionals who are trained for this purpose. And we have a system by which they escalate it to doctors only when a clinical decision or a prescription needs to be given. So even common citizens can come forward. So we actually request people to also come forward. And we also have a large team who's developing which is actually working like a tech company, right? Because at the end of the day, we have built a tech telemedicine backbone, which is being used. So we have developers, product managers, operations folks, marketing people, communication people, everyone. Any people with any of these skills are welcome to build, operate, and maintain the core infrastructure. It's all completely built and driven by volunteers. For any of these, you can actually visit www.projectstepone.org, and all these options are presented. You can apply, and we will get back to you on a daily basis. We are having trainings that are being conducted both for doctors as well as for non doctors to be able to take part and help in this.
Great. Thank you so much.
Dr. Yash, maybe you can also add to your fellow doctor colleagues.
Yes, yes, I've already added a few of them, and I'm continuing to motivate them, because it's a saying, motivation is also contagious.
Yeah.
So once we keep on motivating each other, we definitely will come out of this.
Great. On that positive note, thank you so much. Thank you for your time. Thank you for helping us clear some misconceptions at least. And we will keep continuing with more episodes and more sessions every Wednesday, 6:30, on different things and different issues that we face and what can be done by normal citizens and all of us. Thank you so much, Dr. Yash. And thank you so much, Rags, for your time.
Thank you. Thank you
Thanks
so
a
much,
lot,
Your
Sindhu,
Story. And thank you so much, Project StepOne, for giving me this opportunity to come on the first episode of Your Stories segment of Clear the Air. Thank you.
Thank you. Thank you so
In,
much.
in
Thanks
fact,
a
thank you,
lot,
StepOne,
Sindhu,
that
and your story.
they are giving me the opportunity to serve our country since the last 1 year. I am associated with Project StepOne since almost its inception. Hardly 10 or 15 doctors were there when I joined Project StepOne. So it's good to help people. The feeling that we get helping people, they really get motivated with talking to a doctor over a call. I
Yeah.
would like as much as doctors who can join, who can give their time to come forward and join Project StepOne.